Morning, today is July 7th, 2026. And present with us is the health nurse supervisor Pam Hanna, but first of all, I have 8 sets of minutes from May 5th, June 2nd, January 7th. Oh, let me back up. May 5th, 2026, June 2nd, 2026, and January 7th, 2025, March 4th, 2025, April 15th, 2025, June 3rd, August 5th, and September 2nd, all of 2025. I would entertain a motion.
Motion made.
Second.
Okay, all those in favor?
Aye.
Okay, Pam, would you like to lead us off, please?
Well, we're having some staff transition at the health department right now. Tana's last day was last Tuesday, the 30th. And so after her notification that she was leaving, I started cross-training Erin to do the epidemiology things that Tana had been doing. And Erin is feeling a little bit more comfortable. It will take a little time, but so she's working on a lot of our communicable disease cases right now. Fortunately, we haven't had a lot of them right now. And we just registered today. She and I are both going to a training in September that the communicable disease people from DPHHS are putting on. So we're going to go for a day and a half for some training there. It's going to be in Red Lodge.
Ooh,
I know. It's a little bit of a trek, but
how long is that?
how long is it? It's going to be the 22nd and half of the 23rd,
Oh, okay.
but we'll leave the afternoon of the 21st for travel. And they let out at noon so we can travel back on that Wednesday. And Erin will be out for her vacation that was already scheduled from July 27th through August 6th. And then I'm leaving August 7th through the 10th. So we'll have a nurse, but we'll kind of be shuffling a little there. And so I am expecting that during those couple of weeks that she's gone, I'll be doing a lot more nursing duties since I will be the nurse in the office. My plan to bridge that gap, if we are still down a nurse as we head into respiratory season, which generally starts in September, is to work with Kim Frankie. She's still on our books to serve as a temp nurse. And so I'll see if Kim isn't available to kind of help fill that gap a little bit. We did have one candidate who took another job. So we don't have any candidates for the job right now. So I'm just trying to think, how we're going to cover the duties that we'll have as time goes on, because it goes on quickly. The other staff thing that we have going on, Molly just got back from her vacation, so she should be there for a while. But Jesse had surgery last week, so he's going to be out for at least a week, maybe doing a little bit of half-time or work at home a little bit until we can get him back driving and traveling. So we're down that staff member right now too. And Jesse's always really flexible to help with, phones and customer service, so he'll be missed. I also will probably be taking a couple weeks of sick time in the end of July or August. My youngest grandson is going to have open heart surgery then, and I'll be taking care of the other grandson while his parents are in Salt Lake. So I will need some time when that happens. And right now, like I said, communicable disease cases are really minimal. We don't even have anything in our Midas queue right now. It's all clean, which doesn't happen very often. We're still taking care of our TB patient, and that will continue until the middle of September. And then that drug regimen that observation should be done. We're still helping with some transport with the patient to medical appointments, and the next one will be on July 29th that we take the patient to St. Pete's to have lab work done and see his provider there. And then we're also working with the household members for some care for them right now. So that's our big thing that we're working on as far as communicable disease. We are doing some planning to be at Frontier Days on July 25th, that Saturday. We're also going to be at the farmers market once a month during the summer while they're open, just to have a presence there, talk about some of our services and just communicate with the public a little bit. And then we will be at the county fair in August. So
Good.
I think those are the big things we're working on right now. I did send yesterday a draft of a letter of commitment for Lewis and Clark. They asked if we would do a letter of commitment for a big SAMHSA behavioral health mobile crisis team grant they're applying for. Sounded like it was over a several year span and enough money to employ more therapists and get another vehicle. So they're asking us, Broadwater, because they provide some service to us, to commit to helping with some of the things they need for this grant. So really, I kind of tried to keep those commitments a little bit open until we know more about what that grant looks like. So I don't know if you guys are okay with the commitments I made here. Mostly it's, to be a partner in the project and to coordinate with those partners for follow-up care, which we've got that 988 money, which won't be for everybody, but for some people. And then maybe we can look at how we expand that. Maybe there's some way some of this would help with that. And we kind of talked about marijuana tax or alcohol tax or opioid settlement funds to do some of that work. And then just planning and provide updates. We would give them some time on our mental health LAC as an agenda item. And then I've been attending their mobile crisis response meetings that are monthly. Usually I just get on virtually. I know the sheriff's department also usually attends. There was no one there this time, but I know James is out of town. He's usually their person. And from the information that was on that meeting yesterday, it sounded like they would be asking the sheriff's department for a similar type of commitment letter. So I don't know if they've done that or not, but be nice if we kind of were in line of what we're committing to. So I'm happy to share this with anybody if they want a template. But anyway, if you'll just read through that when you have some time, let me know. The person I'm supposed to turn it into is out until tomorrow, and I think their deadline for submitting is the 15th. So
It looked good to me. I read through it. It looked great.
You're all okay.
Steve replied to you, so I figured that was really the big one he wanted, was Steve's blessing on it.
All right, well, if you're good with this, I'll take the draft off and I'll send it on to them so they've got that. And if the sheriff's department is asking or needs, I'm happy to share my letter with them too, but I haven't done that. I didn't know whether they needed it or not. So those are the big things, just recovering from end of the year, like everyone else, trying to clean up, get organized for a new year. Like I said, a little bit of staff transitioning with what our duties will be most likely going forward for a while. If we're not able to fill that position, might look outside the box at bringing in someone else to do some duties that aren't necessarily clinical nursing duties with that salary resource, so that we're not strapped quite so much. I feel like some of the things we do, like our grants administration could be done by a non-clinical person. Even some of this that we're looking at doing with crisis could be done in a non-clinical person. The outreach we're doing to the community, a lot of that can be done. We're still helping a little bit with environmental health. And I don't see that going away. I know there's a meeting with them this afternoon at 2:30, and I plan to be here. But I think it works really well to have us combining. And so as we look at building expansion, I really would like to keep them in our building if that works. And so I've been looking at options for what we can do there. I feel like what we need is a bigger office space for environmental health that would include workroom and storage for all their files and things. But then I'd like 4 offices besides that for my staff. 3 of them for my staff, and 1 of them I'd like to be a mental health office that could be used for when we're doing some of this crisis work. We could set up a scheduling system with it where local providers could come in and use it if they didn't have a space, or we could have a computer in there and telehealth could be done in that room. But basically dedicated as a mental health room. So that's kind of what I'd like. And then with that side of the building being used for us, I'd like to also try to look at whether we can expand the medical side a little bit so that we could put a conference room in there. For instance, we have this art club going on with our behavioral health work that we're doing, and the person that Rochelle organized as the host isn't able to host now. It would just be so nice if we had a dedicated space where we could do trainings and do some of that kind of work. I'm thinking a room similar to this with an outside entrance that could also be scheduled for other people, like the medical clinic or environmental health when they're doing their trainings, or whoever's, needing it that way. So that's kind of what I'm thinking. I know I got an email from Christina Bigkowski yesterday with our utility bill, and she said that the board had signed the bill of sale so that they were going to be sending it on. So I guess it'll be in our ballpark now.
Yeah, I'm still working on the deed restriction language, so as soon as we get that pinned down, then we'll be ready to sign off and move forward.
Well, thank you for moving this forward. And
yeah, the building 5's kind of falling through on every grant that we had out there, even the
most recent one just got
fire
denied.
grant. Those are almost a gimme, and we didn't get that one even. So, and I think Leah had to step down from her position at the JLEC, so we don't really have a grant writer with JLEC anymore.
well, like I said, I've kind of been thinking about it, have a few preliminary plans and for what our needs are, and I'm happy to talk to contractor or architect or whoever when we get to that point. So
yep, no, that'll be good. Once we get the thing in our name, we'll start designing and get it to an architect or an engineer, whoever needs to put that thing together, and we'll get going on the expansion part of it.
yeah, my one concern would be if we're in a building process during respiratory season, which is our busy vaccination season, but we talked about that in staff meeting today too, and we are used to moving off site. So we'll just, if it works that we're in that space when we're starting to do something, we'll just plan some off-site vaccinations and get people taken care of that way. So
yeah, we'll figure out when that construction might happen, and then we can maybe coordinate with those for the fairgrounds or the volunteer hall, or so you have an offsite.
well, I was even thinking we could go for a couple hours over to the senior center and let people know we're going to be there and get that population, or at the library next door. It's easy for us to pull a wagon full of. So it's just a matter of coordinating with some of our partners, and I kind of like when we do that anyway, because it puts us in the community. So
that's true.
If we have vaccine for farmers market, we'll give them down there.
There you go.
We'll do something.
Yep.
So I don't want to hinder the process. I just want to go. So
Well, that's great.
So I don't know if you have any questions for me, but that's really all my brain has in it to report right now.
Everything's going good up south, or up south, up north, down south?
Yeah.
So, with Tana gone, Erin is gonna be covering our Whitehall Clinic. I'm still covering the Clancy Clinic on the north end. We're really working on making sure as we do, you know, community involvement that we're in all three places. We did have some questions about why the art club is only here. And what we said is that, you know, we have to start it. And then, you know, this is our pilot one. We do plan to do something similar if it's successful in the winter. And I'm looking at maybe doing a traveling show then where we, you know, try to hit some of the local artists who can help us and do it that way. We're looking at other things other than art that, you know, could be outreach and therapeutic and building that connectedness and community. That, you know, would be other types of things that we do. So, and Michelle is connected throughout the county, and so that helps us to. I find that on the north end, it's harder to provide services. A lot of those people get medical type services in Helena. Our Whitehall end, we've had a growing interest in what we're doing out there. They also, as a community, have a lot of connectedness and community involvement. So we've done some interviews with them, some of their key people out there, and they're really doing some good things. So we're trying to piggyback into some of what's going on there. So I think that's part of sustaining some of the things we're doing is to find those partnerships and connect to them and be a part of what's already going on.
Great.
So yeah, I'm not hearing that there's concerns. I know Country Jam's coming up, and
Yep,
so
it's always a fun time.
yeah, that's one thing we always look forward to. So.
Yeah.
Oh,
My whole fire department goes down there, so I sit here and hope the pager doesn't go off.
Mhm.
yeah. So,
Do you have any interest in storage space in the basement of the Old Red Schoolhouse?
yes.
Sure.
Did you say that main room's gonna be divided up?
We're
Yeah, the
we're
room
gonna block some of it off, not the main room, but where the old boiler is, we're gonna look at that big space. There's some other space. You have a locked door there
I
now or something?
do. Somebody, I unlocked the padlock and somebody closed it. I hope I still have a key to that, or we'll have to cut it off and get a new one. But historically, that room has been moist. When, you know, water comes in through that window well or through the wall or something, it's, you know, the side by the creek. So I've either put in pallets or I had a metal shelf for a while that I put in there. So anything we put in there, we kept off the floor. But like we had car seats in there for a while when we got a big order of car seats. And when we'd bring them out, they'd smell musty. So I don't know if all this reclamation has helped that, but I guess I say yes because I've got those sheds I've got to clean out and I want some place that's dry if I'm storing stuff that I don't have to do a lot of other things to keep it from being damaged. So
We'll look at it, but I just wanna make sure that the three entities that are in there can stay in.
well, I'm out there on
Storage.
Friday afternoons if you ever want to look through something together, or I'm
Okay.
more than happy to go out there at another time if, you know, that works out. But yeah, I mean, I would say yes. I'm looking to store stuff. So.
You might, if you're gonna get rid of a shed over there at the clinic because of the building, can we buy you another shed during this construction to put over on the other side by the clinic side, or?
Yeah, there's the one shed over there. I think there's probably room. I think the sheds need to be looked at to see if they're still
Feasible,
worthy to move and keep.
right?
But yeah, I mean, if we can move them over, that's convenient for us to have our outside storage there. We still have some room. We have a FEP shed at Clancy and a FEP shed in Whitehall.
Okay.
Whitehall seems to be full of maybe search and rescue stuff. When we looked in it the last time, it had a bunch of stuff in it that wasn't ours. The one out here, is about half full, the one in Clancy, so I can put stuff in that too. But the only stuff that can go in the outside sheds is stuff that doesn't have to be temperate, so we do have some stuff that has to be inside.
Yeah, maybe just put that on your list. After all this goes through, do I need some outside storage? We can, hopefully put that in the budget if we don't go over budget on the building part of it.
Well, and the room that used to be Tana's is next to the waiting room for the
Mhm.
medical side, and
Yep.
it's not very soundproof and there's not a window. So that in my plan is gonna be our indoor storage
Okay.
space, and that should be adequate. It has a door on it that locks.
Okay.
So, I think that can be set up just the way it is. We'll just get more storage shelves for there. And we've gotten the shelves that are on wheels. The ones at Costco, they're nice and they're sturdy, and we've just been able to use those, and we can move them around as we need to. So we'll probably just fill that space up with that.
Okay.
Put them along the walls and maybe put one or two in the center that we can move around. So I'm not worried about indoor storage once we get
Yeah, I don't know.
moving on expansion. I think we figured that piece out, but my worry is what to do with what's in those two sheds when we start building, because they're
They
gonna have to be
move.
moved
Yep,
off
yeah, for sure.
from where they are out.
Okay.
We are gonna go through them. I'm hoping we can get down to one shed and not two sheds. And that would help.
We could also look at a container that we could maybe put out at the road shop or something, because they make the not really long ones, but a semi-short long one that opens up from the front. So you have, you
So
can
you
see
can get
that
in.
it's really
Yeah.
not deep,
Well,
yeah, well, there's lots of options.
there's also the environmental health shed over here that's
Mhm.
on the county attorney office. Yeah,
Yeah.
by the Paradise Building.
Mhm.
And I don't know what's in that. So there could be storage in there too we can use.
Yeah, we could probably, I was in there the other day, we could probably shuffle some stuff around to give you one side of it or something, but yeah, it's just got shelves in it, and the sanitarian's got just file boxes in there, so. it can
Yeah,
probably be
so that
reorganized.
might be an option
Yeah.
too.
Yeah. Okay.
It's
figure it
just,
out when
we've
we
got
get
to figure
closer.
out what we need to get out, and then we're gonna have to have a spreadsheet to know where everything
Yeah,
is.
that's right.
Yep.
Yep.
All right,
Very good, Pam, appreciate
you.
it.
Yeah,
Thank you.
We'll be adjourned.
I appreciate all you've done for me the last